on in.
Hi, my name is Samantha. I'm going to be your nurse today. I'm going to be closing the curtain for privacy and as well as performing hand hygiene. But before I get started, can I see your wristband? Can you tell me your full name and your date of birth?
Nadia Dana, May 9 of 1969.
Okay, so I'm going to be doing a head-to-toe assessment on you. Okay, so the first thing that I'm going to be doing is assessing your general appearance. And with that, it comes with your hygiene. And looking at your hygiene, you are well groomed. Your posture is straight. Okay, now I'm going to ask 3 questions. What is your birthday?
March 9 of 1969.
Okay, and where are you at?
I'm at home. At
And,
the hospital.
And what year is it?
2022.
Okay, so my patient is alert and orientated times 3. Her speech is clear and the quality is consistent. So now I'm going to be assessing your head. Have you noticed any lumps on your head? Any concerns over your scalp?
No.
Okay, so assessing your head, I don't feel any lumps, bumps, parasites, or lesions. Your hair distribution is full. Okay, so now I'm gonna have you close your eyes and tell me where you feel my touch.
Right cheek, left cheek, my nose, my chin, forehead.
Okay, so cranial nerve 5 is intact. Go ahead and smile for me and raise your eyebrows. Okay, so cranial nerve 7 is intact. Okay, so now I'm going to be assessing Perla. Have you experienced any redness or discharge lately?
No.
Okay, and I'm just going to touch your face. I don't see any redness or discharge bilaterally. Okay, now I'm going to be assessing Perla. And before, her pupil size is a 4. And they are round, equal, reactant to light. And they do constrict to a 3. Okay, go ahead and follow my pen. So her eyes do accommodate, so Perla is intact. So now I'm going to be assessing. Go ahead and keep your head straight, and your eyes will follow this pen. And last one, follows the left. Okay, so cranial nerve 3, 4, and 6 are intact. And then go ahead and follow me. Cover one side of your eye and tell me now. Say now when you see my hand.
No. No. No.
Okay, and the other side as well.
No. 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 No.
Okay, so cranial nerve 2 is intact. So now I'm going to be inspecting your mouth. Go ahead and open your mouth and say ah. I do see that her uvula is midline. I see that her mucous membranes is pink and moist. Go ahead and stick out your tongue for me. Okay, and her tongue is midline as well. Go ahead and take a swallow for me. Okay, so cranial nerve 9, 10, and 12 are intact. Have you experienced any drainage or any redness with your nose?
No.
Okay, go ahead and tilt your head back. I don't see any deviations. I don't see any discharge or redness. You can bring your head back and then go ahead and plug one side of your nose and blow out to the other. And on the other side as well. Okay, so her nose is bilaterally patency. Okay, so now I'm going to be assessing your ears. And the serum is normal. I don't see any discharge or any lesions. which is great. So now I'm going to be assessing cranial nerve 8. Go ahead and close your eyes and tell me which ear you hear the noise.
Left.
Okay, and then
Right.
okay. So cranial nerve 8 is intact. Okay, so go ahead and shrug your shoulders for me. Okay, and then I'm gonna apply push against my hand, and on the other side as well. Okay, so cranial nerve 11 is intact. So now I'm going to be assessing your lymph nodes. This is your submental, your submandibular, prearticular, your tonsillar, your postarticular, your anterior cervical, posterior cervical, and your subclavicle. Okay, so from here I'm going to be assessing your carotid pulses, and I'm going to be assessing it one by one. Okay, and I would say it's a +2 bounding. So now I'm going to be listening for any breweries. And I don't hear any breweries. And now I'm going to be listening to your heart sounds, starting with the aortic, and then the pulmonic, Irvis point, tricuspid, and mitral. Okay, so I don't hear any abnormal heart sounds. So now I'm going to be assessing your thoracic, and I do see that it is normal. So go ahead and towards your back, towards me. Okay, and so I'm going to be assessing her spinal alignment. And I do see that it is straight. Okay, go ahead and take a deep breath for me. Take a deep breath. Okay, and then let me know if you feel any tenderness.
No.
Any tenderness?
No.
Okay, and then go ahead and say 99.
99. 99. 99.
Okay, tactile firmness is normal. There's no tenderness presence, and expansion is normal. So while you're here, I'm going to be listening to your lung sounds. Okay, go ahead and take a deep breath. 1, 2, 3, 4, 5, 6, 7, 8. Go ahead and lift up your arm. Okay, go ahead and lift up this arm. Okay, go ahead and face me. Okay, so now I'm going to do anterior. Okay, lung sounds are clear, posterior and anteriorly. Okay, so I assessed the heart, the lungs, and thoracic, and the back. Now I'm going to move on to the GI system. Have you experienced any urination problem or elimination problems?
No.
When was your last BM? Your
Last night.
Last night. Okay, go ahead and lay down. Okay, so I do see that her abdomen is flat. I'm going to be auscultating before palpating. Left lower lobe. I'm going to lift up your shirt just to hear. Left upper lobe. Right upper lobe. Left lower lobe. Okay, I did hear bowel sounds. They did sound normal. No hyper or hypo. Now I'm going to be palpating. Okay, let me know if you feel any pain or tenderness.
No. No. No.
Okay, so go ahead and sit up. Okay, so now I'm done with the GI system. I'm gonna have you stand up for me. Okay, and go ahead and walk 3 steps in front of me. Okay, and then 3 steps back. Okay, so gait is normal. Go ahead and close your eyes. And Romberg's test is negative. So go ahead and follow my steps. Okay. Okay, and then legs or the hips. Okay, so go ahead and sit down. So now I'm gonna apply, don't let me push, okay? And don't let me pull. Okay, and then as well as your hands, don't let me push down and don't let me pull up. Okay, and then your legs, don't let me push, don't let me pull. Don't let me push, don't let me pull. Okay, so now I'm going to be assessing your respiratory rate. Okay, and I'm going to be assessing the brachial, and it's going to be bilaterally as well. This is rate of bilaterally. Okay, and then I'm also going to be assessing the reflexes. This is tricuspid. This is brachial, brachial radius and bicusp. And this is bilaterally. Okay, and now I'm going to be assessing your your patellar. Okay, and then assessing the pulse of the popliteal. Okay, go ahead and put your feet up just for the video. And then I'm going to be assessing the dorsal pedis and then the posterior tibialis. Okay, and then as well as checking for the reflex, which is less than 3 seconds. And then actually put your foot back. And then assessing the Achilles. And then the plantar. Okay, and then let me see your hand. Assessing the capillary refill, which is less than 3 seconds. Are you feeling any discomfort as of right now?
No.
Okay. So the doctor will be in shortly. If you need anything from me, the call light is right next to you, and your stuff is right next to you as well. I'm going to be performing hand hygiene, and thank you for choosing this hospital.
Thank you.